Dr. Harsha G, consultant cardiologist in Fortis Hospital, Cunningham Road. Today we'll speak about secondary prevention with atorvastatin and clopidogrel combinations. Overview of atorvastatin. Atorvastatin is a statin which is a HMG-CoA reductase inhibitor that lowers cholesterol and prevents cardiovascular disease. It is used in the primary and secondary and tertiary prevention of coronary artery disease. What are this mechanism of action? It inhibits the HMG-CoA reductase inhibitor by reductase, and then which reduces the cholesterol synthesis in the liver. And it will do, it will increase the LDL receptors on the liver cells and enhances LDL clearance from the blood. What are the FDA approved users? It's in the dyslipidemias and including primary hyperlipidemia, mixed dyslipidemia, hypertriglyceridemia, and primary dysbeta lipoproteinemia, homozygous familial hypercholesterolemia, and in the pediatric heterozygous familial hypercholesterolemia. What is its overview? Again, atorvastatin. Sometimes we have like an other FDA approved is like a primary prevention. Those are, and in the secondary prevention, like it lower the risk of myocardial infarction, stroke, revascularization procedures, and angina in high risk patients, including those with type 2 diabetes mellitus and without coronary arteries. This is the primary prevention one, and the tertiary is like it will prevent the non-fatal myocardial infarction and fatal and non-fatal stroke, hospitalization for congestive heart failure and angina in patients with a coronary heart disease. And what are the cardiovascular benefits? MI, stroke, angina, revascular procedures, heart failure, hospitalization will decreases. And then we'll come with the other drug like an clopidogrel, which is an antiplatelet drug, which is an P2Y12 inhibitor, and which reduces the platelet aggregation. What's its approved uses like a myocardial infarction, stroke, and a peripheral arterial disease. Sometimes in the half-label stable ischemic heart disease will use, but it is no atrial fibrillation with thromboembolism are not there, and then we can use it in the symptomatic carotid artery stenosis and post-CABG peripheral artery angioplasty, bypass, TAVI, and TAVI and TVAR procedures. We can use it in the off-label use. And what are the benefits of the combination therapy? So many will give like instead of a single drug, we can give like a combination of therapy. What it will do, it will improve the blood lipids. That is, the atorvastatin improves the blood lipids. It decreases the bad cholesterol like an LDL and increases the slight HDL levels. And what about clopidogrel? It will have like a platelet aggregations prevention. So by combining all those things, it will decrease the risk of cerebral infarction and adverse reactions. What are the clinical trials with these drugs? It will have a clinical effect of atorvastatin, calcium plus clopidogrel on blood lipids and platelets in patients with transient ischemic effect, TIA. So where the clinical outcomes of the patients treated with the atorvastatin plus clopidogrel significantly better compared with the control group, you can say. And platelet related indices like a PT, APTT, and PLT showed no significant difference between the group before and after treatment. So here there is a clopidogrel alone versus the clopidogrel plus atorvastatin. Atorvastatin effect on clopidogrel efficacy in patients with a peripheral heart disease, which shows the patients on the clopidogrel combined with the atorvastatin showed significantly less platelet inhibition compared to clopidogrel alone. Next is the dynamic effect of a non-CYP3A4 metabolized and CYP3A metabolized statins on clopidogrel resistance in patients with cerebral infarction. So investigate the treatment effect of the combining the statins, atorvastatin or rosuvastatin, with clopidogrel on cerebral infarctions. What it shows, the platelet reactivity index was similar between the both the groups, between the atorva and rosuvastatin. So next trial will be like an simultaneous admission of a high dose atorvastatin and clopidogrel does not interfere with platelet inhibition during PCI. So simultaneous administration of high dose atorvastatin and clopidogrel loading dose during PCI has no significant impact on clopidogrel platelet inhibition efficacy. Okay, and then next trial is an high dose atorvastatin and the pharmacodynamic effects of a double dose clopidogrel in patients undergoing percutaneous coronary interventions. Patients in atorvastatin group significantly reduced in the total cholesterol, LDL cholesterol, and triglycerides, and in high dose atorvastatin significantly improved the platelet effect of double dose clopidogrel in our stable CAD patients with STPR undergoing PCI. So what is the guideline recommendation? Single antiplatelet therapy with clopidogrel to reduce the risk of major MACE events in patients with symptomatic peripheral artery disease, and moderate intensity statins or a high intensity statin like in 40 atorvastatin of 40 to 80 mg depending on the statin benefit group to which the patient belongs. And what are the key points of this one? Is atorvastatin is a statin that lowers cholesterol, prevents cardiovascular disease, and is used in the primary, secondary, and preventions of the coronary artery disease. And clopidogrel is an antiplatelet drug approved for the treating in the unstable angina, NSTEMI, and STEMI patient under. And then what are the combination therapy benefits? It will improves the blood lipids by lowering the LDL and total cholesterol and triglycerides, and enhances the platelet indicators like it reduces the risk of infarctions and minimizes the adverse events. So combination of therapy resulted in lower triglycerides, lower total cholesterol, lower LDLC levels, and though platelets inhibition was effective when combined with others, no significant relationship between the CYP3A for metabolized statins and clopidogrel response was observed. See, atorvastatin is a cholesterol lowering drug, and the platelet inhibitors like clopidogrel, these are the mainstay of the treatments in the both the ACS events and the stable coronary events, and we can use it in the other like a peripheral vascular disease and cerebral diseases.